Heartbreak and anger in Brampton after a 13-year-old girl dies of COVID-19.
It's hard not to feel that we as a system have betrayed her family.
Coming up, why experts say this tragedy was preventable.
Doug Ford asked the federal government for military help to get hospitals through the third wave. As hospital cases climb, the request for more frontline staff, and how the province is now considering sending 50% of its vaccines to hotspots after recommendations from the science table.
It's 20% of the areas in Ontario that are causing 80% of the infections.
Citizens of Canada have the right to enter, to remain in, and to leave Canada.
The calls to ground all non-essential air travel in Canada grows louder. Tonight on City News, the complexities and politics at play.
Good evening. There is heartbreak, sorrow, and anger in Brampton tonight after the death of a 13-year-old girl. Emily Victoria Vigus is now one of just 3 people in Ontario under the age of 19 to die of COVID-19. Doctors, politicians, and community members say with vaccines now available, this was a preventable and horrifying tragedy and highlights the urgency to send more vaccines to hotspots.
Members will please rise.
A poignant moment of silence in the Ontario Legislature to remember Emily Victoria Vigus. The 13-year-old, now one of the youngest victims of COVID-19 in the province and the country. Flags flew at half-mast at Brampton City Hall, a community shattered by the news. The mayor lost for words.
It's like getting hit by a truck. That's the way I felt when I read this story.
He tells us the family of the young girl was following all public health protocols, but Emily's father is an essential worker at a Brampton warehouse, and he was the only one to leave their apartment in months.
It's why we've been screaming from the top of our lungs for the last 5 months from Brampton, vaccinate essential workers.
While Emily's father was vaccinated April 12th, it was already too late. Her mother was taken to hospital just 2 days later and has been in critical care since then, according to media reports. Emily began showing troubling symptoms, including a fever and difficulty breathing, a week after her mother. On April 22nd, she was rushed to hospital, where she was later pronounced dead.
There is urgency to vaccinate our essential workers. And I don't want to hear another story like this. I don't want to hear another story that rips your heart out like this.
There have been urgent calls to get more vaccines to Brampton, which has a COVID-19 positivity rate of 22% and has been a hotspot since the very start of the pandemic. Brampton has had 400 workplace outbreaks, and the average age of an essential worker in the city is 36, so many still aren't on the list to get a shot.
How many more deaths will it take before the Conservative government gives Brampton the support we need to fight COVID-19?
She was a young woman who was just starting out in her life, and it is a tragic situation that she passed away. However, we all need to remember that we are working as hard as we can to bring vaccinations to as many people as possible.
Doctors calling it systemic failure.
It's hard not to feel that we as a system have betrayed her family. I don't know what we as a health system, as a society, say to Mr. Viegas.
In the meantime, a GoFundMe created for Emily's family has already raised close to $80,000. Friends of her father say his loss is unimaginable.
Last time we kind of spoke to him, he's saying he's not even getting out of bed. It's pretty devastated.
Doctors say it remains incredibly rare for children to develop severe illness from COVID-19. William Osler says this is the first person under 19 to die of the virus within their health system. And the Office of the Chief Coroner confirms they are investigating the death of a 13-year-old to understand the circumstances more clearly. We've also heard from the Dufferin Peel Catholic District School Board. They tell us this is a loss to the entire community, and their prayers go out to the family, staff, students, and all who are impacted. Over now to Cynthia Mulligan with a look at today's COVID-19 numbers. Cynthia.
Well, Tina, on this very sad day, we are seeing a significant drop in new coronavirus cases. But the question remains tonight whether this is just a one-day blip or a key moment in a slow but steady decline. Today's count of 3,510 is the lowest single-day total in nearly a week. But more significantly, the 7-day average has fallen below 4,000 and is down 11% from last Monday. But the death toll remains high at 24, while 869 patients are in intensive care. That ICU number has doubled since the start of April. And Toronto continues to report a quadruple-digit increase with 1,015 new patients. Peel Region isn't far behind, sitting just below the 1,000 mark. 79% of today's new cases are coming from the Greater Toronto and Hamilton area. And here's a frustrating pattern we see every weekend. The number of vaccines administered absolutely plummeted to 69,000. That number has been closer to 130,000 for most of last week. And the situation is so concerning in Ontario, the federal government is sending military personnel to help after a request from the province. Up to 3 medical assistance teams are preparing to deploy. It was just a few days ago the Ford government rejected a federal offer of help with vaccine distribution. The pandemic may be showing some signs of slowing in Ontario, but the situation in hospitals continues to worsen. ICU cases are at double the peak during the second wave. More than 600 people are on ventilators, and the Sunnybrook Field Hospital now has its first recovering COVID patient. In a statement, the Solicitor General's office confirmed the province is asking for more medical personnel from the Canadian Armed Forces and Red Cross, as well as logistical and operational support for hospitals. Health Minister Christine Elliott today also noted frontline health workers from Newfoundland are about to arrive.
I believe there's a team of 9 people that will be arriving tomorrow. So we're very grateful for the help that we're receiving from Newfoundland. They're experienced in intensive care, and one is Premier Fury's wife, who is a critical care doctor herself.
The Ford government continues to take heavy criticism for its handling of the pandemic, in particular, vaccine distribution.
I think the province completely blew the whole vaccination rollout. It was a terrible rollout. It was confusing. It still is confusing.
Now, for the first time, the government signaled it may change distribution. These long lineups at pop-ups show the need in hotspot communities, with people waiting for hours for a chance to get one. Currently, 25% of vaccines go to hotspots. Late last week, the Science Advisory Table recommended that be increased to 50%, saying the move could prevent 20% of infections among those aged 16 to 59. Today, the health minister said the government is considering it.
They are now recommending 50%, and we're looking at that now. It's 20% of the areas in Ontario that are causing 80% of the infections. So we take this recommendation very seriously.
The Premier needs to send the fire department to where the fire is raging.
No announcement yet on sick days. Last week, Premier Ford promised to create the best paid sick day program in North America after public outrage over his decision to close playgrounds and have random police checks, which were walked back. The Science Advisory Table has been calling for them since February. And a vaccine shortage concern continues to be a reality across the province. Maliha Sheikh now has that story.
Cynthia, troubling news for those who booked an appointment to receive an AstraZeneca shot. Pharmacies are low on supply. The Ontario Pharmacists Association predicts doses can run out in just days.
It is challenging because demand continues to outpace supply. We're managing it through wait lists as well as walk-ins and booking appointments. But likelihood is very high that we'll have a supply interruption heading into next week. It's one of the reasons that we're working with the government right now to launch a limited launch of the Pfizer vaccine into pharmacies, focused on hotspot regions so that we have continuity when it comes to supply.
Chief Executive Officer of the OPA, Justin Bates, says over 1,400 pharmacies across Ontario are dealing with a lot of uncertainty right now. Bates says he's hopeful that the federal government continues to engage in negotiations with U.S. President Joe Biden in getting the U.S. supply here in Canada, since doses are sitting in a warehouse and the states likely won't be using them, adding the shots will be expiring soon. White House Press Secretary Jen Psaki said today there are approximately 10 million doses that could be released if and when the FDA allows it, which could happen in the coming weeks. There are also 50 million doses that are in various stages of production, which could be completed from May to June. Psaki would not say whether Canada would be getting any of those doses.
Our team, our national security team, our COVID team, working with the State Department and others, we're going to assess a range of requests, a range of needs around the world. But we're working through what the process will look like, and we will consider a range of options from our partner countries. And of course, much of that will be through direct relationships.
We reached out to the Ontario Ministry of Health for a comment, and they said in part with approximately 245,000 doses remaining and future shipments not expected until May, we will continue to administer AstraZeneca to individuals 40 and over in pharmacies and primary care settings until we receive additional supply. They also say it's up to pharmacies as to how many doses they will administer, as it does depend on individual supply. Pharmacies are also expected to reach out to patients if there's a need to change appointments. Now, tonight, there is growing concern in the surge of variant cases in connection to international travel. Our Adrian Gabriel has more on that story.
Yeah, Malia, the calls to ground non-essential air travel, it's growing louder, though the complexities of making that a reality are far from simple. And there's some tonight who are saying the government simply isn't doing enough and that there's plenty of politics at play. Each international flight landing at a major Canadian airport brings with it a risk. The third wave of this pandemic has been driven by a variant which was originally detected in the UK. The depressing data shared by one of Ontario's medical officers of health today.
There are now 54,949 confirmed cases of variants of concern in Ontario. The vast majority are still the B117 variant, which was first identified in the United Kingdom.
There's also 36 cases of a new variant of interest in Canada's largest province, which was first detected in India. On Friday, all international flights from India and Pakistan were grounded by the federal government.
We have some of the most strongest measures anywhere in the world.
Canada's Minister of Public Safety has repeated this line multiple times over the last several days.
More than a year ago, we banned all non-essential travel from abroad by land and by air for all non-essential travelers, and we took the extraordinary and unprecedented action of closing our border with the United States for non-essential travel.
It's true, Canada has banned non-essential travel, but only for foreign nationals, not Canadians. Thousands continue to cross the border daily. Minister Blair has also been repeating that international travel is responsible for less than 2% of all of Canada's COVID cases. The one prominent political science professor claims the Liberal government are spinning the numbers.
All that Bill Blair is talking about are the percentage of people that are caught at the airport where if they've been tested. All you need is one case from abroad, and then once you start getting community transmission, you can't track that the original source was from abroad.
On April 10th, the City of Toronto reported 1,063 new cases of COVID. 743 of those were variants of concern, making up 70% of all the cases on that single day. Recently, the Ford government has ratcheted up their calls to stop non-essential air travel, though according to Nelson Wiseman, Ontario is also playing pandemic politics.
Doug Ford's performance in the past 10 days has really been disastrous. And so what the Conservatives are now trying to do is to deflect attention onto the federal government.
So would a ban help? According to one infectious disease physician and scientist, yes, but we must first do a risk-benefit analysis.
if you truly want to prevent, almost 100% of the cases from coming into the country, you have two options. One is to stop all travel, and the other option is to have a similar type of border measure that places like Hong Kong, Australia, New Zealand have, where you have to isolate in a quarantine facility for 14 days.
Now, many experts and members of the public are quick to point out that there's a bit of an unequal playing field. You arrive from abroad at an airport and, well, you're supposed to go to a quarantine hotel. Now, that hasn't been a really smooth transition. Now, if you fly into the United States, let's say, fly into Buffalo, you can drive or walk across the border. Arjao Lili has that part of the story tonight.
Once you get to the border, you're met with a customs officer who just kind of goes over your information and then sends you to go get the test, and then you're on your way.
Federal opposition leaders say Canada's land border needs reinforcement and are demanding new efforts to stop COVID. But one Canadian traveler tells City News crossing the border by land is simple but thorough.